This number is derived by dividing your total body fat over your total body mass, multiplying by 100, and therefore giving you a percentage. Body fat percentage is going to be a lot more accurate in patients, particularly who are bodybuilders or who have an elevated muscle mass, because if you calculate BMI in these patients, it's going to be high, indicating that you have more fat or adiposity than you actually do. Now, how do you decrease your body fat and get that defined look you're trying to get? Well, you have to be in a caloric deficit, which means you have to be consuming less calories than your body is burning. And what is normal body fat? For men, it's about 8 to 25%, and for women, it's about 20 to 35%. There are different ways that we can measure body fat. One is the DEXA scan. This one administers a very low dose of radiation and tends to be used to assess bone mineral density disorders like osteoporosis, which is a thinning of the bone. It's actually found in a lot of fitness facilities right now. The other one is impedance measurement. Some of the devices look like this, and some of them look like that. Basically, what these devices do is they use the electrodes to measure your electro bioimpedance. And with that number, there's an estimation that's done in a calculation to look at your TBW, or total body water. And from there, estimations and calculations are done to look at your body fat percentage. Now, there's a couple of other displacement measurements that can be done. One is hydrodensitometry. And hydrodensitometry, you actually are submerged into water, and that water is displaced. And from that displacement, your body fat percentage is calculated. A similar test is whole body plethysmography. It works similarly to the one I just mentioned, but you're using the displacement of air to measure your body fat percentage. So this way you don't have to be submerged in water. And the last common way is with calipers, is when you actually pinch your skin fold to assess your body fat percentage. This is the least accurate way of all the ones I just mentioned, and particularly inaccurate in obese patients.